Council to order. Commissioners Barbara Baca, Olivas, and Commissioner Benson are excused. APS member Benavides will be attending via Zoom, as well as, I think, who else? Also Councilor Champagne. Thank you. Silent invocation and pledge of allegiance. Please join me in a silent invocation followed by the pledge of allegiance. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, moving on to item number 3, approval of minutes. I move to approve the minutes from the February 20th, 2025 LGCC meeting. Can I have a second?
Second.
Thank you, Councilor Feeblecorn. All in favor, please say aye. Aye. Oh, we have to do roll call because we're, okay. Can we do, Shanti, please call the roll?
Yes, Madam Chair. Madam Chair Barboa,
Yes.
Councillor Rogers,
Yes.
Councillor Feeblecorn,
Yes.
Councillor Champagne,
Yes.
Councillor Grout, Dr. Sengel,
Yes.
APS member Vice Chair Jackson,
Yes.
APS member Benavides,
Yes.
so called.
Thank you. I also move, I move to approve the minutes from the March 4th, 2025 LGCC meeting. Do I have a second?
Second.
Thank you, Council Feeblecorn. And is there any opposition? Can I do it like that? Or do I have to still do the roll call? Okay, roll call.
Madam Chair Barboa,
Yes.
Councillor Rogers, Councillor Feeblecorn,
Yes.
Councillor Champagne,
Yes.
Councillor Grout, Dr. Sengel,
Yes.
APS member Vice Chair Jackson,
Yes.
APS member Benavides,
Yes.
so called.
Thank you. And I believe, do we have anyone here for public comment?
We don't have signed up yet.
Thank you. So we have no public comment. We'll be moving to item number 5, new business. Our first item is the debrief on opioid settlement and next steps. We have Dr. Wayne Lindstrom to lead us. And Ellen Braden, thank you, from the city.
It's on the desktop.
No.
Unless we go all the way down here.
Can we get some support for that? Oh, there's Javier, sorry.
Now we have to go to the slide deck presentation.
Well, I don't know where the slide deck is. This is just the.
Well, we found it, but how did we get it to slide deck?
This is just the PDF.
Oh, there it is. Aha. Right here.
Thanks.
Is it up? It's not up there. She'll need to switch it up there. Madam Chair, members of the commission, sorry for the technical difficulties.
No
We
worries.
found the
Thank you.
presentation and we have it in presentation mode, so we can
Wonderful.
proceed. Again, I'm Wayne Lindstrom. I'm the Deputy County Manager for Behavioral Health, and with me
Is Ellen Braden. I'm a Deputy Director with Health, Housing, and Homelessness with the City of Albuquerque.
Thank you.
we wanted to give you all an overview of what's in the implementation plan with regards to the expectations around dashboard reporting. The expectation is that we collaboratively fund and design and implement a joint publicly facing dashboard to report at a minimum the anticipated and appropriating body with regards to these funds, the monies that are received, the monies that are expended, and a detail regarding all of the funds and their expenditures as well. But perhaps most importantly is the expectation that we develop matrix related to the oversight and accountability and efficacy regarding performance metrics for the use of these funds. The dashboard is intended to be featured on each of our respective bodies. And one of the things that Ellen and I would ask members of the EAPS school board is to supply us with the information around who the appropriate person would be on the APS side of the house regarding the planning for this expectation. The next slide is really an example of program level accountability matrix. This was done by the Research Triangle Institute, which has done a lot of consulting with states in terms of helping them develop their metrics. This is not what we intend to do. We still got considerable design and development work to do yet. But when it comes to looking at various domains, including process variables and outcome variables and production variables, etc., we will be presenting to you in the future something akin to this. With regards to settlement allocations and spending, this is an easy one. Maricopa County, which is basically the Phoenix metro area, has their dashboard on their website. So I just presented this as an example of what this will look like for us. I think this is pretty straightforward and self-explanatory. With regards to allocation estimates and actual payments, we will be doing this by source, by the settlement decree and the amounts and the schedule of what we're anticipated to receive, and then actually how that conforms to what we actually get and when we get it. And lastly are the funded projects that we would end up funding, basically. This is where the hard part comes in. So there's all kinds of things I think that accrue to us relative to doing meaningful dashboard reporting, doing actual and meaningful data collection in and of itself is a challenge. And we're going to talk in a little bit about all the obstacles that get in the way of doing this and doing this well. But it also means doing meaningful analysis and reporting and making recommendations from the data that we actually collect and analyze. As a result of doing this, I think it really enhances all of our credibility with the public and with the stakeholders. It raises awareness, and it can guide a lot of our decision making along the way. We're taking a look at, is there a way for us to do some meaningful alert surveillance, if you will, and there are some public resources that we potentially can tap into, and we currently have staff examining those so that we can hotspot where we've got particularly a toxic substance being distributed in the community and get alerts out, etc., so that we're all aware in something akin to real time about what the potential dangers are out there. Ellen, if you want to.
Sure. So one thing I would add about this is that we do want to make sure that we have meaningful metrics across all the different projects that are funded. And we want to make sure that what we're reporting is directly related to these opioid funds, and that it reduces stigma rather than raises stigma. So what we've laid out here is possibilities, but things that we can use, right? We can inform future funding. We can inform where our needs are. We can inform the collaboration and what areas of town may need some additional supports.
So building off of that, we anticipate that we'll have informed decision making, that this will promote our collaboration with community stakeholders, that will foster the adoption of evidence-based practices, and that we'll be able to visualize overdose trends and spikes and patterns in the community. It'll give us some insights about resource allocation decisions and intervention strategies that we should deploy. And we believe it will foster more effective collaboration overall. What you have here and on the next slide is what gets in the way. I mean, it's real easy for all of us to say, you know, we need a dashboard. And there are all kinds of dashboard templates out there that we could put on our respective web portals today. But, you know, the old adage, garbage in and garbage out, is not what we want. So one of the things that I wanted to use this opportunity is to appeal to all of you to be patient with us. Because the reality is that why there hasn't been meaningful reporting over the last 50 years I've been in this business is because of all of these obstacles. And I'm not going to belabor and go through all of them, but there are more disincentives than there are incentives. So the reality is that unlike some states that have a management information system statewide for reporting on all state dollars that go into services and supports, we don't have that. And even in states that I've worked in the past who implemented and had such systems operating for a decade or more, found that it was reporting and trending of data that did not make the state actually look very good. And oftentimes those reporting systems were later shut down. So if information or good data isn't collected in the first place, then it makes it very difficult for us to report and be able to analyze data that, you know, doesn't exist. And the reality is the bulk of behavioral health services in the state are funded through Medicaid. And Medicaid's unable to provide us today with what the utilization is in Bernalillo County for the services that they pay for. Now, that's not particularly relevant to how we use the opioid funds, but when we talk about building out a behavioral health continuum of care and being able to report system-wide, this becomes extremely challenging when the major payer for services in the county isn't providing that data. And there are developments on the state that have been going on, and they should have had a system in place in 2020 that the federal government paid 90 cents of every dollar to develop. And it's 2025. We don't have it yet. But when we do, I think it's going to have tremendous opportunity relative to what we are able to measure and report on and develop and track in terms of quality services, effective services, efficiently delivered services over time. Are there other things you want to say, Ellen?
Sure, thank you. The only thing I would add here is the things that the barriers or things that we'll be looking at when we design the dashboard so that we can ensure that there is meaningful data. There's all kinds of reasons why we can't provide data, but as long as we have matrix that cross programs and cross projects, we should be able to have meaningful data. It might be not widespread, but it will be meaningful to the dollars that we are distributing.
And a major barrier, in fact, is that those provider organizations that have sufficient scale have electronic health records. And the last thing that those providers want to do is to have to do duplicate data entry, for example, have different reporting. And the reality is that if you're a provider of any scale, you're not just getting Medicaid reimbursement, but you're getting Medicare, you're getting private insurance, you're getting funded by us, you're getting funded by the city, you're getting funded by philanthropy, et cetera. And all of them have different reporting requirements. So in the beginning process of this, we might come out of the gate with looking at a web-based reporting of aggregate kinds of data that we can then analyze and report on, et cetera, until we get some of the various data platforms that are out there talking to each other. And, we've got Unitas, for example, is a closed loop referral system that's a wonderful tool. But right now it doesn't report to the state's system that they're using, and it doesn't integrate today with the health information exchange and with these various electronic health records. So there's a larger body of work here. So we're going to be looking at where the low-hanging fruit is, and we can get some meaningful reporting to all of you, while we're also developing new ways of collecting data and overcoming some of these barriers. So again, I just urge being patient with us through this process.
Thank you. Yes, Councilor Rogers.
If I could just
Maybe we'll finish.
do one final piece here. Vital Strategies, which is the entity that we contracted with to do our strategic plan for the opioid settlement funds, is offering us a position that they will pay for to provide us technical assistance. So this will be additional resource to help us do some of this work. We've got the agreement. Our legal, for example, is reviewing it as we speak. They will be paying for this position. They will be hiring for this position, but this person will work for the city and the county through September of 26. So we intend to take advantage of that resource. And we want to basically be able to report to you on, what we're doing, how are we doing it, and is anyone any better off as a result of what it is that we're ultimately going to be doing. So with that, I'll take questions and answers. Thank you, Madam Chair, members of the Commission.
Thank you so much for preparing this and being and for your presentation. Councilor Rogers.
Thank you, Madam Chair. I love the outcome measures, the process measures, and resource measures. I think that's something we forget a lot about. One, they relate to each other, but they're very different outcomes. I would just ask that we start with the things we control, right? So the community asked for, how much money did you get? Who's getting it? When did they get it? Start with that, and I think we can get that up quicker. But I understand the outcomes and all of that would be take more time. But I think starting with what we can control and get up in a dashboard quickly is those items. And then I would also align the requirements for your measurements, whatever metrics you come up with, align those with the contracts that we're doing in HHH or in the county, so that it's in their contract, right, that here are the metrics that we want to, and I know we already do that, but if we have some alignment, especially on the opioid settlement money, then regardless of if they get it from the city, the county, Crossroads, we're all on the same page in our contracting. So that way we know we're all at least tracking the baseline data that we need.
Madam Chair and Councilwoman Rogers, I would just add that we want to be able to align as much of everything that we do, not just with this pot of money as well, so that, again, we don't further complicate service providers' lives, etc. And so in any place where we can have alignment, that's what we're going to be shooting for across the board.
Thank you. Council Feeblecorn?
Thank you, Madam Chair. And first of all, I just want to thank you. We literally passed this at the city last week, and the county hasn't even passed theirs. And we are already working together and coming up with solutions on how to get information out to the public. And I think that's incredible. And really the point of all of this was to have us working together and not duplicating efforts. And so this is really exciting. And I just wanted to thank both of you for this really, really quick turnaround and a plan to move forward in a quick manner. It's just makes me so happy. And then I wanted to second what Councilor Rogers was saying about let's just make sure we put all the requirements in the contracts as we are giving out the grants to the community nonprofits and to the service providers, just to make sure we get all the data that you want, because I think you're the experts that know what the data is and what it should look like and how you want it delivered to you. So let's just make sure we do that. But again, just really wanted to thank you both for coming together and coming up with this plan in such a really quick and thorough way.
Thank you, Council Feeblecorn. Any other discussion? I just did want to note, so I just want to make some notes that I feel like technology is so interesting, and we learned even during COVID that even in Albuquerque, there are plenty of people who don't have access to internet or a computer to get on the internet or those things. But having this live is so important. And I know, I just feel like it does take money to keep it live and keep it active and keep it real. And that's often, I think, people don't put the funding in so that somebody is doing that work on the back end and collecting that data. So I think important to make sure that that's there. And I would love to learn more about those other states that have management systems and ways that we can support that either locally or for our state level. And then I guess last I wanted to add that two things, that CJ's or the jail currently has a dashboard, and so does our youth detention center, the Bernalillo County Youth Detention Center. And I guess I just wondered, everything to me is integrated, and I don't know how we would integrate, or we definitely need to have something focused on opioid settlement dollars. But I think for the long haul, how once opioid settlement is moving along, how are we making sure that we see the full picture and those pieces together? It's a lot to chop off, I understand. But thank you for the presentation. Thank you for keeping us. And I just expect that, I think you'll see on our agenda later, Vice Chair Jackson and I got to meet. We're just hoping to be able to talk about the dashboard, get updates on the dashboard every meeting, knowing, every other month there may not be much to do, but also so that we know, each of our entities know what we need to do to be contributing to that. Yes, Councilor Rogers.
Thank you, Chair. You talking about the funding made me think about that, when we would have an amount that this would cost, so that we know that as the three entities, because the idea was that we would split that. So if you have an idea of cost, I know from some of our conversations with our own DTI, Department of Technology and Innovation, that they feel pretty confident they can do some of this work internally. So if we can save money there, that's great too. But also know that we did write it in that each of the entities would help with that. So it would be good to know if there are any costs that are associated with that you know of.
Okay, I'm ready.
Okay, I think, yes, Director Sam.
Dr. Sam. Thank you. I just wanted to say and acknowledge what I heard you all say, and I appreciate staff working together. It's really important for you all to work together in the design phase, because we know that we serve we work with many of the same providers. We also have independent providers that have unique scopes. And as we think about building out a dashboard related to the opioid settlement funds, I think it's really important that we are designing metrics that are within scope of the work that they're doing. I think burdening any of our providers in a way that it becomes onerous will only move us backwards. And so I appreciate what I heard from you all, that not only did you ask for time, which I think we all need to give you to do this well, but also give you the opportunity to really refine that within the scopes of what we are funding through these funds, and ensure that we're not asking providers to do something that really actually creates challenges that makes it hard to be our partner. We often hear about reporting with government being sometimes so onerous that they consider whether they really want the support. And I think we want everyone to participate with us in the most effective way, and we want to have as many providers doing the good work interested in working with all of our entities. And so I appreciate that you're asking for time to get this right, and we will. I think we can all appreciate that you'll do the good work to make sure we can. So thank you.
Thank you.
Thank you both.
Thank you.
Yes. I'll just note that one of the things when we were interviewing Dr. Lindstrom for his DCM position, I wasn't in, but I was in the room. That was one of the things I got so excited was he talked about wanting to make things less burdensome on providers, which is so important. Thank you for bringing that. We'll move on to item 5B, legislative debrief, behavioral health and public safety. From our, I believe on Zoom, we have Ricky Lee Chavez, if she is available. Yes, there. Ricky, you're on mute. Yay. Hello.
Good evening, Madam Chair. Am I coming through okay?
Yes, we can hear you. Is there a way to spotlight her on the Zoom? Maybe I'm asking too much. Thank you. Yes, go ahead, Ricky Lee. Thank you for being here this evening.
All right. Thank you. Thank you, Madam Chair, members of the commission. Thank you for allowing me to appear via Zoom. My family is traveling for the Paschal holiday. My name is Ricky Lee Chavez, and I am the founder of Capital Counsel and Consulting. Our firm was retained by the Bernalillo County Criminal Justice Coordinating Council, and we provided legislative coordination services during the 2025 regular session. And I am here at the request of Commissioner Barboa to provide an update on certain topics that were covered during the legislative session as they relate to this commission's work. So briefly, this was a 60-day legislative session, which means that we started the Tuesday after the Martin Luther King holiday and concluded on Saturday, March 22nd. Legislators had until February 17th to introduce legislation. We tracked over 100 pieces of legislation as they related to topics that were of concern to the coordinating council. And the legislative session concluded with a few bills that I think would be of interest to this group. One you have heard a lot about in the press and over the course of the session was House Bill 8. House Bill 8 was this year's omnibus criminal justice public safety package. And that bill included 6 different pieces of legislation that were put into one comprehensive package that was under the number House Bill 8. It was sponsored predominantly by Representative Christine Chandler, and then other members of the legislature signed on to that. What that bill did was it took 6 different pieces of legislation, as I said, and those pieces were, first, it took in components from House Bill 4, which addresses criminal competency and treatment. That was a topic that was covered substantially during the interim. It was a topic of concern during last summer's very brief special session. So there were changes made to our criminal competency statutes as well as our assisted outpatient treatment programs under AOC. The bill also included changes to fentanyl trafficking sentences. So individuals that are convicted of trafficking fentanyl in certain amounts saw their penalties increase. Additionally, there was the creation of a 4th-degree felony for a shooting threat. And also there was the creation of a new crime for possession of what's a weapon conversion device, or what we commonly refer to as Glock switch. Also, there was an increase in the penalty for certain vehicle thefts, and also there was some changes made to our DWI laws with regard to how the process works to draw blood for suspicion of DWI. So that bill did pass the legislative session pretty early on. It was signed into law by our governor before the end of the session, as you see through our constitution. If bills are not passed or are passed during the session, the governor only has 3 days to veto them, or they automatically become law. So that was actually enacted within that time. The second part of that package was a behavioral health package, which was also a priority for the legislature, and a priority for the beginning part of the session. So there was 3 bills. They started on the Senate side, Senate bills 1, 2, and 3. 1 and 3 are ultimately the bills that passed, and those bills create, under the AOC, the Administrative Office of the Courts, a framework for establishing behavioral health regions. Each region will be established by the AOC after they do regional resource mapping. And then those regions will create their own regional plans of how they're going to address behavioral health and their corresponding needs around in that region that's established, with the resources that are available, and how they would then rely upon other regions if they do not have those resources. Senate Bill 2 was the funding mechanism that was wrapped into the overall budget bill, which is House Bill 2. And then Senate Bill 3 created a behavioral health trust fund. And this trust fund is established to take money that's put into it, appropriated to it by the legislature from the general fund. And it will be used to continue to fund whatever those behavioral health regions and their needs are after this initial funding is utilized. So those were the big bills that did pass and that did take up a significant amount of time in the legislature. Like I said, there were we tracked over 100 bills because as you all in Albuquerque are aware, public safety, criminal legal reform, juvenile justice reform is something that is continuing to come up in our legislative process. Our Democratic majority and our executive office are at odds and don't necessarily agree on the best way to address those issues. And so there is continued dialogue about the potential for a special session, other times where the governor may call the legislature back before they go into their next regular session next January to address these concerns. However, there currently is no agreement upon the between the executive and the Democratic majority in the legislature on what those types of reforms would look like. And without that kind of initial agreement, many believe that it's likely we would see an unsuccessful special session like we saw last summer. And so those are the highlights, Chair Barboa and Commission, and I'm happy to take any questions or, if necessary, provide additional information if I don't readily have what you're asking available.
Thank you so much, Ricky Lee Chavis, for this great analysis and summary. I was struggling trying to keep up with all the bills, and so thank you. Really appreciate you. Does any of our folks have questions? Well, wonderful. I did have a question just about, is there within these plans, especially these Senate bills 1, 2, and 3, establishing the regions, and then I've already heard Dr. Lindstrom talk about how he's engaged with the regions, but are they inside the plans? Are there already ways that that name out how municipalities and are the Bernalillo County or the city will be working to get those dollars? Is that already in the plan, or is that another thing we have to wait for?
There's a list, Chair Barboa, members of the commission, there is a list entities that can receive funding as it relates to those plans that are established by each region carrying out the work as designated in statute. So there's a list of entities, but until the regions are established and the plans are approved by each region, knowing specifically what role each entity, say local government or something like that, or a coordinating council, what they would specifically receive. That's going to be something that is determined later on.
Wonderful. Okay, well, we'll keep up with that. I think I have you on our agenda for later this year to see how the interim might be shaping up. But
I look forward to joining you in person at that time, Chair Barboa. Again, thank you for accommodating me via Zoom.
oh, absolutely. And thank you for taking the time from your family. And I hope you have a great holiday weekend.
Thank you. You too.
No other questions? Great. Thank you. Thanks so much. We will move on to item 5C. We have Tyson Patterson to present on Keeping Them Alive. And I believe, we have ACS here to talk about summer nonviolence events and activities. And I believe, yes, someone from Spree, or was that, I think you might, anyways, I think Tyson has it. Great. Oh, nice. Push the button for the mic, please. Thank you, Tyson.
Is it on? Okay. Hello, Commissioner Barboa, the rest of the councilors and commissioners. Good evening. I'll have a brief presentation on the Keeping Them Alive, as I just handed you guys out a calendar of our up and coming events and some events that we have already began to occupy for this year. As you see in the red, those will be the sponsored events that are sponsored and purchased through the media matched. The purple are most events, 80% or more, sponsored by Commissioner Boa. The blue is the APS events are part of the APS poster project and request by the Crossroads counselors. And the green are the community-based. These are the events that result from community extending us invitations and or signing to participate in these events. We have, as you see, let me flip this over. So in April, we actually started this actually in the end of February. We have displays with APS. We work with the Crossroads counselors. We do have a mobile memorial museum that we do display. We have the public schools. The Crossroads counselors are signed up on our calendar, which we have created to spread out our museum throughout the different 13 high schools right now currently, which we are working with to get them in the middle schools as well. This is the display of some of the family members that have been deceased overdose from the fentanyl. And we actually bring this as part of our prevention project with the Crossroads counselors. So we set these posters up in the schools. They have QR codes, which the students can scan, which gives a background story to the student and also the way that it affects the families and children and friends as well. And so far, it's proven to be pretty effective, actually. We've set up at El Dorado for 2 weeks. We are currently in Sandia. We did an event at the Cibola High School. And actually, we've already had students that have recognized people on the posters, some of the posters that are posted. We have some of the posters that are actually active now that 2 of the students on the posters were students at Cibola High School. So the students at their health fair were actually in shock to see them with the Cibola High School football jerseys on the posters, and meet with two of the mothers of those students that actually went to that school. So they had some real deep conversations with those students, and how accessible it is to get these fentanyl in the schools, and different things. So we get a lot of feedback already from these. We also have the red events like the Mexico Athletics Association. These are sporting events through the high schools that they request and allow us to set up displays and table as well, which have proven to be also helpful. I believe at the state basketball tournament, we picked up maybe 16 families, new members to join the Keeping New Mexico Alive from seeing the display that weren't aware of the program. And they are now working on posters of their family members and joining in the fight and the prevention with us to keep this work going and keep our efforts alive. The Summer of Nonviolence, as you can see, we also have 4 dates already scheduled. The calendars are still filling up. These are not complete. We're still adding as we go. We do have several volunteers that volunteer at the group from the group to table these events. So it's proven to be a very productive project that we have going, and we would like to keep this project continue going.
Thank you so much, Tyson.
Thank you. Chair Barboa and everybody, thank you for the ability to join you today. Just brief comments on the Summer of Nonviolence and really our excitement to join with the Keep NM Alive and really our partners in county and everybody else who contributes, which is a pretty wide network. We're gearing up and we started meeting probably in January. I'm really excited to be here. I apologize, I didn't introduce myself. I'm Jeffrey Bustamante with Albuquerque Community Safety. Right into it there. I'm here because Lisa was feeling a little under the weather, so we were really happy to partner and just jump in and provide an update that it will be similar. It may not go quite as long on the back end, but it'll kick off in June again. We already have events that are getting scheduled. The best way I can really summarize it is bigger, better, more nonviolence. And it really is this concerted push to host a lot of healthy, happy, fun, safe events for families to attend. But it's not just that. It's with the strategy that while we have them, let's try and make sure we're supporting them. So when we will have meals for them and the rest, and as part of getting the meal, we'll do surveys. And part of that survey, we'll even ask, does your family need services? And we follow up on every single one of them who ask for that. We're also looking at, with our Violence Prevention Division and really ACS at large, how we can be capacity builders to some of the needs we're seeing in the community and what we're bringing very intentionally. We table, our partners table, but making sure we're getting the right partners to the right events. I think one of the best lessons from last year at the pool party, which was a blast, was let's try and get some swimming trunks donated or some swimsuits, those sorts of things. So really do more, like I said, bigger, better, and more of it, but while still protecting the fidelity of what we really started last year, enhancing key partnerships and those partners that really delivered for us last year. We're making sure we're properly supporting them. And it'll be everything from more movies, and we're really excited about that. The drive-in movies were a huge hit. I think the first one we expected about 200-300 people, and there was right around 1,000. It was a really exciting thing. To more events throughout, and making sure we're getting across all of town. We'll use, of course, our beautiful new facility for some of that programming and the rest. So I'm happy to answer any questions.
Thank you so much, Tyson and Jeffrey. Really appreciate this. 2 notes. Thank you for the calendar. I don't know. I need a drink of something. And I just wanted to note that, when we held these last year, like the 1,000 people showing up at the movies or the really robust, every event had so much attendance. People, I wouldn't have imagined so much. People were taking Narcan. Like I think we ran out at most events, so we need to be more prepared for that. And I just want folks, I grew up in the 90s, And Tyson and I live in close by neighborhoods, and our neighborhoods were impacted. There wasn't a time when you couldn't drive through and somebody trying to sell you crack or get crack from you. And a lot of times people talk about the fentanyl as if it's something new. Well, it's definitely different. It's definitely more potent, but our communities have experienced it before. And just like then, the solutions were very much about how do we engage our neighbors? How do we bring in and stay more connected? And just like right now, young people were the blame for everything. And yes, I want to say that I was a young person at that time, and I remember that we couldn't walk 3 in the mall without being called a gang, and had all these sort of really punitive and things placed upon us. The point of these events is to say, when we give, we learned, just like Dance, 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 the teen thing saved so many of our lives. Those community events that were free or affordable to all our families that gave young people something meaningful to do. And that's what these events are about, having 1,000 young, and I asked Lisa, like, well, was it a bunch of old people that showed up at the movies? No, it was a range, mostly young people, mostly young adults. That is what we want to do, is have ways that our communities have something to do that is meaningful, that is affordable, and keeps us busy and doing good stuff. So I just want to thank you all for that so much. Yes, Councilor Rogers.
Thank you, Chair. I'm excited. We got to help last year with, and I think same thing with the pool party. We planned for 300 and had like 800. It was a lot. I know we tried to bring Dance, 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 It's a Teen Thing back at Juneteenth. I wouldn't say we mesh those again, but we should still think about, as a county, city, and APS, how do we bring back Dance, 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 where it's an every Friday thing like before? It was brilliant. And I'm a child of Dance, 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 It's a Teen Thing. So it was brilliant because everybody was at the thing on Friday, right? And then everyone stayed home Saturday night to see who made it on TV, because they broadcasted it on Saturday night. Everybody was like, no, I can't go out. I got to see who. I mean, now with technology, they can watch it anywhere, so it probably won't have the same effect. But I really think we can do it at Cliff's Amusement Park. They have, we need to really put in some thought in how do we bring this back. Because when I looked at the youth crime data before Dance 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 thing ended and then after, youth crime went up. And so we've got to figure this out. And I think this crew here is the perfect place to have those conversations and to, let's all do this. We need to give our youth, and that's why I'm excited about these. So even if we don't bring Dance, 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 It's a Teen Thing to Juneteenth, I hope y'all are there with a table, because again, our kids don't get access to these type of resources often. And so we still need to make sure, and it's on June 14th. Civic Plaza.
Thank you, Councilor. Yes, Vice Chair Jackson.
Thank you so much. I have just two quick questions. Tyson, when you were discussing the APS, the poster program, and you said that you have determined that they are very effective.
Yes.
I'm wondering if you could just elaborate a little bit more on what you mean by they've been very effective. You mentioned, that the students are interacting with them, but can you elaborate on the effectiveness?
So not just the students, the teachers are as well. So at El Dorado, they actually turned it into some class projects. They walked students through. They got feedback from the students. The health teachers for the freshmen took all of their classes there, had them, give reports back, reviews, and it was a lot of positivity and a lot of discussion. It opens it up for discussion, and even while we're setting it up, we have a lot of discussion with the students that they are experiencing it. It is out there and it is accessible, and we're just there setting up, and they're opening up and they're having conversations even with us about how accessible it is, and they're really emotionally involved. We don't have a slideshow or anything tonight prepared, but we have pictures of the students giving hugs to the mothers and having long conversations with them, not being forced to, at their own will, engaging in the conversation, engaging in the stories, scanning the QR codes, and and hearing the stories of the people in the pictures, they identify with them. There's some kids in ROTC uniforms. There's some that tried it for the very first time, which was their last time. All the stories are unique. So they share that information with each other, and it comes back full circle. And we see it. We see it immediate impact.
Thank you. I appreciate that. So it sounds like it's really fruitful for communication and to kind of start having those conversations amongst themselves.
Yes, definitely.
Okay, well, thank you for that. And then my next question is for Jeffrey. Thank you. In regards to the Summer of Nonviolence events, I just wonder, is there a way, have you given any thought to, can APS help in any way? Even just information sharing? Is there anything that you would like me to take back to my entity as to how we can assist with that?
So Chair Barbeau and Member Jackson, absolutely. We love, we have a few partnerships with APS and all of them are invaluable. So I'll make sure to get my contact information over to you. And I think I messed this up a little bit, sorry. And we'll make sure to see what we can do also just for the summer programming, and also that we're highlighting, I know city, county, and APS put a lot of energy behind like healthy summer programming, so we can probably use that as an opportunity to highlight all the great work you guys are doing as well.
Okay.
So
Yeah.
I'll reach out.
Thank you. I appreciate that. Yeah, I do know that the superintendent has the extended learning and the programs are set and ready to go for the summer. So however we can collaborate, help, assist, information share across the entities, I think that would be fruitful for all of us. And in the spirit of collaboration, right? That's why we're here. So just let me know.
Thank you.
Thank you.
Any other questions? Thank you so much. Thanks for your presentation. And I just want to bring folks, this spree event, I think, is the the next event, like sort of big event coming on. It is primarily Crossroads leads this, and I think they got all these partnerships, but this is directly APS led. And I love that. Thank you, Vice Chair Jackson. I think I always say, like, sometimes our groups are so siloed, but we should be sharing all the information about all of these. And we will be hearing later from APS about their healthy summer events. Thank you. Thank you. Thanks so much for making it out tonight. Okay, we'll move on to 5D, Assisted Outpatient Treatment Program presentation by Katina Watson and Judge Beatrice Brickhouse, Second Judicial Court. Thank you for being here.
I have a PowerPoint here somewhere.
Great.
Okay, good evening, and thank you for having me. My name is Katina Watson. I am the CEO for the Second Judicial District Court. I'm here to talk to you about assisted outpatient treatment, but before I get into some of those details, I do want to thank both the county and the city. We have a number of collaborative programs with you all, and we are so incredibly grateful for your support and your partnership. I know many of you have heard a lot about some of our treatment courts. Those are the ones that usually get a lot of the attention, like young adult court, adult drug court, mental health court, DWI court. We have a number of family court counseling programs and educational classes. This particular program, Assisted Outpatient Treatment, is a collaborative partnership with the city. They provide the funding for this particular program, and this is somewhat different. This is a civil treatment court, unlike everything else that we have and mostly what you hear about. So I'm going to do my best to get through some of this. I apologize. Our program manager, who's the real subject matter expert on assisted outpatient treatment, took a vacation. So I am not as good as she is at this, but I'll give it my best shot. So assisted outpatient treatment is a form of civil commitment. It's a court-ordered program that provides judicial oversight for individuals with severe mental illness and who struggle with voluntary treatment and adherence. The goals of AOT are to reduce the incidence and duration of hospitalizations, arrests, incarcerations, violent episodes, homelessness, victimization, and other consequences of treatment non-adherence. It's also to reduce financial strain and overcrowding on our community's emergency resources, such as hospitals, overcrowding in your jails. And it's here to support individuals to achieve and maintain stability within the community by focusing on their personal goals in correlation with treatment plan. As I noted, this is a civil program. It's court ordered, and so Presiding Judge Brickhouse, who could not be here tonight, and she sends her apologies that she couldn't be here, but she is the presiding judge over assisted outpatient treatment. And the court's authority is not predicated on the commission of a crime. I'll get into who can petition into AOT, but it's a civil legal procedure, and there's not really sanctions like we have in our criminal treatment courts. Rather, there's consequences for noncompliance, and the judge can order very specific things. It's essentially what I would describe as managing of an individual and their treatment plan. And when somebody doesn't adhere to the court's orders and that treatment plan, then it goes into micromanaging, and there's a series of things that the judge will do. So, and it does not require the individual's voluntary choice to participate as well. The participant criteria is the individual must be a Bernalillo County resident and 18 years of age or older and have a primary diagnosis of a serious mental disorder. The person has to have a demonstrated history of lack of adherence with treatment for a serious mental disorder and had a significant factor of hospitalizations and or incarcerations. There's a few things that can play into this, but it's usually these individuals that we find continuously cycling through the hospitals and the jails that have severe mental illness. The criteria to petition into the AOT program is essentially, it's outlined over here on the far right of this presentation: an adult roommate of the person, a parent, spouse, an adult child, sibling. What's going to change come June 20th from HB 8 is that the district attorney is now going to be able to petition into AOT. We met with a team at the DA's office a couple of weeks ago, and they're standing up a team to work on serving as the petitioner in this role. And we're working with them to map out a plan of how that's going to look going forward. It's going to really exponentially increase what we see in AOT. And so we're being fairly strategic on trying to come up with, a game plan to accommodate this new referral. That new referral source, or actually it's not even a referral source, they can petition. It really aligns with what's happening nationally and how other states handle it. So that's going to be a significant change, but we are preparing for it. This goes through the referral and evaluation process, which I'm really not going to get into too much. Let's see. what the individual can expect once ordered into AOT. They're going to have to follow a treatment plan. They're going to have to come before the judge on a regular basis. They're going to have to attend all their appointments, keep the clinical team advised of current addresses and locations, and maintain consistent communication with the clinical support team. Now, there's a whole team that's involved here. We have case management, we have medical providers, and our staff, as well as the judge, and there's a lot going on behind the scenes to keep that going. Transportation, meeting the individual where they're at, finding them, getting them to their appointments. There's a lot that goes on, and the team works pretty aggressively to keep these people in the program. It is a 12-month program, and it can be extended by the judge. The pamphlet I handed out has demographic information as to what we see in our AOT program. I won't get into that too much unless you have some questions. It also contains participant outcomes of when we had when we were operating in FY20 and FY21. You can see we had really good results for our participants. For example, the hospitalizations. We had, of our participants, 78% were not admitted to the hospital. We had a 79% medication adherence compliance rate. And so we had an 87% non-arrest rate of our participants. So these are really good statistics. And this is what we see what the national trends are. So our program was aligning with what the trends are nationally on this. And that's the presentation overall. Like I said, Laura Braun is our program manager. She's the real subject matter expert for AOT, and she couldn't be here. I apologize that you have me tonight, but I'll try and answer whatever questions you might have.
Thank you so much. We're really glad you're here. I want to give Councillor Champagne, who I believe an opportunity to, or if it was, I believe it was him who asked for you to come, but I'm really glad you're here. Did you have anything you want to say, Councillor Champagne?
Yes, Madam Chair. Thank you very much for the information and the presentation. And I hope it was as informative for my colleagues as it was for myself. So I appreciate it.
Definitely. Thank you for bringing it. Yes, Councillor Grout.
Thank you. I, too, appreciate you and what you do for these individuals, I think. And then I like to see the outcomes that are more favorable. So we know that this program works, and that's always good to see. So thank you. CAO Single was telling me that it is in the budget, so that's what we were looking for, just to find out as we're going through our budget process. So we're looking for it. Thank you.
Thank you.
Thank you. And I see Councillor Benavides' hand up. Go ahead, Councillor.
Thank you, Madam Chair. I hope you all can hear me. And I got a promotion tonight, but Board Member Benavides. Thank you, CEO Watson, for being here this evening. And I apologize if you addressed this and I missed it, but you did say that you had data from FY20, FY21. When did the program start exactly?
Thank you for that. So I don't have the exact date. Ellen Braden might know this because it actually started around, I think the MOUs were originally signed around 2017, 2018. There was some work to establish the program. Then there was a grant that funded the program for a period of time. It was a federal grant which had some restrictions and a lot of limitations. And as it relates to AOT, we learned were very challenging. But I want to say about 2017, 2018?
Yes, that's when the program actually began, but we took our first clients in FY20.
Okay.
Okay, thank you so much.
Yes, thank you, and Councillor Rogers.
Thank you, Madam Chair. Can you tell us about your other funding? So if like specifically if the DA is going to ask you to do more, are they going to fund the program?
Great question. Madam Chair, Councilor Rogers, at this time, there was not any money for FY26 for assisted outpatient treatment. There may be some funding available through the behavioral health regional planning, but I don't know when that might be. We are going to continue to seek some general fund appropriation. We'll see how the legislature handles it. We were not given any money to do AOT by the legislature in FY26. We are being very, very creative. We have talked with, we met with the city this week. We're assured that there is funding for the program in FY26. It's going to be essentially a flat budget, but we are being very, very creative in sorting out how to expand the program within the same budget. It might take a little bit of time to explain that. I don't know if you want me to go into those details at this time. I can get with you offline.
No, I think that says it all. You're expected to do more with the same amount of money.
Yes, and we are working and developing a plan to do just that.
Thank you.
Thank you, Councilor Rogers. Thank you again. I did have a question. So right now, I believe that I've heard before that there's also a wait list that often, so when the assisted outpatient treatment, are you usually partnering with nonprofits in the community to provide that treatment?
So right now, we have one particular service provider, and we are going to, Laura Braun, our program manager, she is reaching out to a variety of service providers to make sure we have a much larger net of service providers. In short, how we're looking at expanding it is if we're saving some money from the DAs doing some of the, serving as the petitioning attorney, that frees up some of the, petitioning attorney contract. We're reaching out to MDC potentially to have the individuals that are incarcerated and have the medical professionals there that can serve as the physician that can do the assessment. We'll save the money there. We can put it towards the case management. We're making sure that, these people are on Medicare, getting them set up through Medicare just as quickly as possible. So that can be billed appropriately and continuing to bring down the costs so that we can add more participants. We don't have a waiting list right now, but we are we've been doing a lot of outreach, and we're starting to see the referrals start to come in.
And I had another question. So I was in a Familiar Faces program that had like sort of nationally folks in it. I think these are the same folks we're talking about, people that like in your presentation that frequent between our jail, the hospitals, and services, all our services, city and county services. I was made aware there that every state has ability to hold folks on a temporary hold, but they determine how. So it sounds like the DA and this judge can, or this is through the court, that the judge can, can mandate the assisted outpatient treatment as far as for diversion from other consequences, right? And then they have a pretty robust program to follow.
Yeah, I think it's slightly a little more complicated than that. But yeah, I think in a nutshell, overall, conceptually, yes.
Okay, but right now, just Judge Brickhouse can order folks to this program, and the DA looks like.
Well, no, the only one that can enter an order is the judge. They can petition. The DA, come June 2nd, the DA will be able to file a petition, but there's a series of things that have to happen, and the judge will ultimately order somebody to AOT.
Okay, thank you. And last, I wanted to ask, I love that last slide that shows the success. That's huge success. It's a shame that we're not robustly funding it. But if, and knowing that it was only 2020 that we actually implemented it, I think even more visual to show people the impact will be to show what those numbers look like before implementation to what they look like once the program's running. So maybe there's a way to get those numbers. I want people to feel and see the difference it makes. Yes, Councilor Rogers.
Thank you, Madam Chair. Question, do you get any behavioral health dollars from the county?
We have a variety of contracts with the county. I have been discussing with Dr. Lindstrom some behavioral health funding.
Thank you, Madam Chair. That's why I asked, because the county has all the behavioral health money. And so I'm glad Dr. Lindstrom and I'm sure Commissioner Barbeau are on it, but I would love to see some of that funding go to this program. I know it's something that the city helped initiate. So I get why I think our budgeted amount last year was 900,000. Is that correct?
That's correct.
From the city? But can I ask Ellen, where is it in the budget? Like exactly where do I find? I have it here. I'm looking at the appendices. If I know Sam's working on it too, so I just want to put it on. I'd like to know where it is in the budget because I'm doing a word search and I'm not finding it.
Madam Chair, Councilor Rogers, I will show you because I know it is in the budget. We've talked about it. There may have been a clerical error so that you may not see it, but it is in the budget. It is funded for next year. I will be able to show you where it is in the budget.
Wonderful, because I need to put my eyes on it to trust but verify. Thank you very much.
Thank you. And I do know, we can ask for a future presentation about the county and the courts, diversion courts, other things. There are plenty of ways that we have relationships with there, and I know Dr. Lindstrom's been talking with them as well.
Madam Chair, can I make one additional comment and one additional plug for AOT? Because this is a coordinating commission. There are so many opportunities, as Katina had indicated, to have different petitioners and different qualified professionals to bring clients into this program, such as MDC and UNM with the inpatient hospital. And so we may approach you all in other areas so that we can get support from those systems to be able to refer into this program. So thank you.
I think that's what I was trying to sort of ask for. And that's this body policy. We can make those changes. When I said I was in that familiar faces, I went to Utah, and basically there are so many law enforcement, community social workers. There's so many people that can petition for this type of treatment or for different programs. And I think it's so important that the people on the ground working closest to it can. And I think it's what the state's asking for through all these requests for special sessions.
So, Madam Chair, one of the caveats about this program is that law enforcement cannot act as a petitioner. And so that makes it even more challenging sometimes because we know the Crisis Intervention Unit at Albuquerque Police Department carried some of the same people that we ended up seeing in the treatment program, but it was finding the petitioner. So House Bill 8 will kind of, I think, open that up with a DA to have additional petitioners to be able to bring people into the program. So there's some real possibility here, and you can tell I'm really excited about this program as well. So thank you very much.
Oh, thank you. Appreciate your excitement.
And we've been prepping some of the civil judges. They're excited to join the program and add additional tracks to accommodate the increased referrals and petitions that we're anticipating.
Any other questions, comments? Thank you so much, Katina. Appreciate you coming out this evening. Great. We are on our last item, item 6, approvals. So I was able to meet with Vice Chair Jackson. Oh, sorry. Nope, I'm wrong. 5E. Human Trafficking Awareness Campaign, DC Andrew Jaramillo with APD Special Victims Division. I saw you there, sorry.
No worries, thank you. My name is Andrew Jaramillo, Madam Chair, board members, and I'm here to talk a little bit about the campaign for the Human Trafficking Awareness. And I got invited to the meeting on Friday to discuss some of the human trafficking stuff that, the board was discussing. And And some of the success that we saw as far as the HRVU unit with the Albuquerque Police Department, which is the high-risk victims unit, and we deal with the sex trafficking and human trafficking in our city. And so one of the things I brought up is that we have seen an increase in the tips that we've been receiving from the community members, being that the awareness has been pushed out to the public as well as city workers at most of our facilities. And one of the things is, just like Councilor Rogers, I also am a 90s kid who grew up with Dance Dance the Teen Thing and also a Great Dare program. And those programs are awareness programs. Like you said, on Saturday nights, we would all be watching, trying to get our friends or matter of fact, or seen, my wife who used to be a performer for the event on the TV show. But one of the things that really stood out is every single time they would talk, they would bring up the awareness part, right? They would talk about why it's cool to be clean and why it's important to stay away from drugs and gangs and why, and these awareness programs are, I'm a product of that. I mean, when I was in school and I grew up in the South Valley, going to schools in the South Valley, I could easily went a different direction, but, having law enforcement, teach us about why gangs are not the route to go or why drugs are something you need to stay away from, really stuck to me when I was in elementary school, and I saw that I could possibly become in law enforcement in the future, seeing people from my community teaching me, and I'm definitely a product of someone making it aware of the dangers. And so with the human trafficking stuff, one of the things that I did suggest is our schools are also a good place that we might be able to share this awareness. Working with human trafficking and seeing the victims that we do deal with, I do believe that some of these kids might be around it and not even know it, and can be a pathway for us to get these tips where we can start investigating. So, I like I said, I'm definitely a fan of anything awareness, and if it wasn't for these programs, I don't know necessarily where I would end up. But I do think that if we continue to push forward and put it in your face awareness programs, we can definitely make an impact in our community.
Thank you so much, DC Jaramillo. Yes, Councilor Rogers.
Thank you, Madam Chair. I think I've seen a difference in some of the awareness in the city facilities. I saw that we put up the signs in the stalls, which are captive audiences in the stalls. The only feedback I'd give about the signs is I recently traveled with Councilor Grout to DC. Their signs were very similar to ours, but they had actual education about how to spot something like human trafficking. So it said, is it a young adult that doesn't look like they want to be with that other adult? Or like they had some really good, I took a picture of it. Did you see it too? Because it really broke down what signs to even look for in that education, as well as the hotline and how to report. And so that's the only thing I would add to our signs, is just that little education about what signs to look for that I didn't even know, that made me go, that might help spark somebody to notice it in the first place. Because I think the awareness of what we're even looking for might even help. But I'm so excited to hear that the tips are going up for my district. The human trafficking ring that we have in town right now, I see it. And I think the awareness at schools, so that we specifically give students especially with the two minors, your unit worked with the county sheriff's office to really crack down on that. And those youth, it was heartbreaking to hear that they were really groomed and ended up running away because they thought these men loved them and were going to take care of them and take them off to a better life, right? When no, they were just trafficking them. 14-year-old girls, right? And so that type of awareness within schools for youth to know where they're going to come for you. Is it social media? Parents, so that they can be watching and looking for these things at home too. It was terrifying to me, but this stuff, I agree 100%. The awareness is really where it's at, and I would love to see what we can do with APS about that.
And just to let you guys know, I do believe that we have the awareness part of it that's really big because, having, when I came on this department, it was a little bit different when it came to working with the community, but we also have discovered that it's a force multiplier when we get into the community and they're the eyes and ears for us. And, with the cases that you're talking about, the awareness part's there, but also it's a perfect time because with this administration, we've been able to really build on our human trafficking and sex trafficking units in which we're able to tackle it together. So when we're getting the tips, we have a unit to actually respond and take action and hopefully save some children that are involved or whoever's involved. So.
Thank you. Yes, Councilor Grau.
Thank you, Madam Chair. Thank you for being here this evening, sir. Tonight I am hearing a lot about our children and taking care of our children, and this makes my heart so happy. They are our future, and prevention is important. These are tough subjects, and I'm sad that we have to have these conversations, but it's important that we do and we start young. And I love the collaboration. I love hearing results, that it's making a difference. And I too am starting to see seeing the literature different places, and I think that's important. I know that there's a national campaign, and I think it's important that we also incorporate that into ours, because if somebody is trafficked and brought to across state lines and they see a similar picture, something similar, it'll catch their eye. So sadly, we know it's all over the country. And so if we could have that continuity too, I think that would be helpful. But it's really wonderful to hear it's working, that people are aware. And it's neat, like when we've traveled and we're seeing that in other places. And so I'm really pleased that Albuquerque's getting on board too. Thank you.
Thank you.
Thank you. Yes, Vice Chair Jackson.
I was on the whole time. I just wanted to make sure that I got your contact information before you leave tonight, and I can get you in touch with, or at least can share your information with Chief Gallegos, so that you guys can maybe start a coordination on an APS police and APD. So just make sure you give me your contact information before you leave.
Absolutely.
Thank you.
I just want to make sure I'm not missing anything from Councilor Champagne online.
No, Madam Chair, I'm good. Thank you.
Thank you. And thank you, DC and Hadamio, for being here tonight. Such important work. Thank you. I did not intend to miss that. So yay, now we're on our last item, number 6. I was able to meet with Vice Chair Jackson since our last meeting. And I just, in previous years when I was chair, wanted to sort of put to keep it relevant, hopefully keep people coming. This does not mean that these are the only things that can be on the agendas, but sort of wanted to see, we only meet every other month, so see some ways we can look ahead to what our agendas could possibly be. This is definitely open for discussion or removal, and at any time, you are, as you received emails from Shanti here at the county, you can add things as we did this evening, or ask for a change in the agenda as we come up to them. But I hope folks have been able to, we won't have to read through all this. I wanted to note that every time we do want to have an update on the public dashboard, so that we can continue to stay on top of that. Otherwise, I did want to hear back from Ricky Lee, as I heard otherwise, and just keep the sort of great information coming and the way we could think about continued collaboration. Member Jackson, is there anything you want to add to this item?
No, thank you. Madam Chair, I appreciated the opportunity that we had to kind of sit down and talk about how we could collaborate. I really appreciate the continued focus on accountability through the dashboard being on the agenda every month. And just from the APS side, when I did reach out to the superintendent to see, what was important for her for collaboration, just so everybody's aware that she wanted to see how we could focus on summer activities for the kids, especially our middle school aged kids. I think even with the opioid settlement, the Crossroads funding going into middle school, so often it's our middle school kids that get lost in the shuffle. So any collaboration we can continue to work on with our middle school kids. And then you will be hearing very soon, if you haven't heard already, that we are going to start implementing career academies into our high schools in collaboration with United Way. And so we're really excited about that. And that is another place where I think that the entities, the county and the city, that we can all work together to really make sure that those career academies are beneficial for our students so that when they graduate, they have a path forward. So that's kind of what the focus, the general focus is for some of the items that were placed in here. The third item that is probably a theme that we all hear a lot about is the chronic absenteeism. So some of these activities, the career academies, the focus on middle school, is meant to also address chronic absenteeism, but any help that we can get on that would be really appreciated. So I don't know if my fellow board member Benavides, if you have anything you want to add. We can't see you, so if.
Thank you, Madam Vice Chair and Chair. I don't have anything to add. I think you summarized it very well, but I thank you for the opportunity, and that's all.
Okay. Thank you. Yes, any discussion? Yes, CAO Single.
Thank you, Madam Chair. I would just mention, I think there are multiple partnerships between APS and the city that I think we would love to have this body have the opportunity to learn about and hear about in terms of the successes. Our school-based violence intervention program is based in APS high schools, and we've had incredible outcomes, and we're actually expanding in partnership with Superintendent Blakey as our partner in that. And we also have a couple other APS partnerships that I think there's real value for us to be talking about, because the scale of them may benefit from all of us thinking through the opportunity to invest in these. And we have multiple places. I think that the three of us are also already potentially great topics for us to be talking through in terms of. I love the idea that we're thinking about children as well, especially with APS at the table. And there's real value, I think, in this coordinating committee to be thinking about the ways in which we're already working together and and getting kind of those updates to think as we go forward. So I would suggest that the city probably has multiple suggestions of places we would like to see on the agenda as well. And so I'll ask our team to send those to us.
Definitely. Yes, let's add them. And keep talking about the possible collaborations and ways to keep bringing in folks. I got several calls about, well, what about the charter schools and what about the community centers? So we want to keep building more. We don't have to think of this in scarcity. We should be thinking about what do we build to actually connect and build on. So Councilor Rogers.
Thank you, Madam Chair. I'm excited that you have walking school bus and alley activations on here, because those are happening with under leadership from community and Commissioner Barboa, and I jumped on. I think the other thing I would add to that is the guaranteed basic income pilot, including the one not done that we're launching at the city, but also the one done by the Assistance League that actually did it specifically for chronic absenteeism. They put out their own RFP, and some of the schools responded, and they gave students guaranteed basic income for attendance, for good attendance, and their attendance shot up. And they have outcome data, they have all the data, and would share that with us. We could have them come present. But I think that would be a really good one for chronic absenteeism. And we're doing participatory budgeting, and we have a project right now that came from Wilson Middle School, kind of in addition to, and I want to thank Member Benavides, because she was really awesome at joining us in those meetings with the community and the county about how we can really just beautify the 5 blocks around the school. And this came directly from the community school council and the students saying, okay, city, like, why are our stop signs faded? Why are our crosswalks faded? Why don't we have trees in the back of Wilson Middle School? Why do we have dirt? Why do we have weeds? All of these things in their neighborhoods. So that is the project that is winning right now. And so that means we as a city would take the lead on beautifying the 5 blocks around the school. And I think this would be a great group to talk about that type of thing, talk about what is the capital plan for APS for those schools. So while we're working on the neighborhood, you all are working on the building, the actual structure of the school, and could really be a beautiful partnership with all of us working on our neighborhoods around our schools. And this came directly from the mouths of the babes of what they want to see in their neighborhood. So I'm excited about this, and I think we really could do some good. The only other thing I want to say about public dashboard in an opioid is also the grant program. Updates on planning for that joint grant program, making sure we have updates on how that's going. I'm extremely interested in how we separate that process from our regular RFP process and making sure we can give access to folks in an easier way and continue to get those updates here about that as well. Thank you.
Thank you, Councilor Rogers. And you said the League of that was
Assistance League.
League.
They're a really powerful group of retired ladies, a lot of them teachers. And so this was near and dear to their heart, and they've been they did the pilot, I want to say 2022, 2023, around there. So we can invite them to come and share what they did. It was pretty awesome.
Wonderful. Thank you. These are great ideas. Great to keep learning about things we can raise money for that we know are being successful. And Council Member Benavides, Board Member Benavides.
Thank you, Madam Chair. Councilor Rogers did mention the walking school bus, and thank you so much for mentioning that. And I would be remiss if we didn't acknowledge the volunteers from Whittier and Wilson with the help of APS who really put that into place and to implement it, because keeping our students safe is our #1 priority, and they really knocked it out of the park with that. So thank you for mentioning it, and thank you to Commissioner Barboa and Councilor Rogers on being a huge effort in getting that completed. So just wanted to mention that. Thank y'all.
Thank you. I love it. It is absolutely beautiful. Great. Wonderful. So are there any other discussion? Sounds like we have some good additions. Folks know we can still keep adding to this. Look forward to the work ahead. I move we approve the agenda. I don't know that we really need to pass it, but we probably don't. It's under approval, so do we have to take action because it's under, I don't know the rules.
It's mentioned as an approval.
Under approvals.
So
let's
Madam
just
Chair,
move
this is COO Julie Baca. Apologies, I'm not there in person.
No.
Can you hear me okay?
Yes.
Okay. So I think we were being cautious in adding this under approvals so that you all have the ability to make the vote. However, if it's something that's going to be added to later, that would conflict with what you're voting on this evening. So I think we can just move forward on the minutes that there was consensus, and we will plan for having these items on future agendas with addition of other items if necessary.
That sounds perfect. Thank you, Julianne Baca. So we won't vote on it this evening. Thank you, Santi and Javier. But we will, and it didn't sound like there was any disagreement about it. We'll keep moving forward and have the opportunity to add or adjust the agendas as needed. So we have meetings sort of set all the way through December, so get yourselves ready. Announcement of the next LGCC meeting will be Thursday, June 26th, 2025. The meeting at 5 p.m. here in Ken Sanchez Commission Chambers. Thank you, and meeting is adjourned. Yay. Yay. Thank you.